participants, which we'll discuss towards the end of today's session. Like probably maybe by 3:45, we'll discuss the type of study, which 6 studies we have shared in the group, and you had to see the only the design part, means there is a not the data collection, because we were going through the assignment which you guys have submitted. So many of you have like written regarding the analysis or regarding the data collection method, but till now we have not covered that. So we expect only the methodology part from you guys, what we discussed. So I'll be sharing my screen. Let me open. So yesterday we discussed about there are various types of data collection methods, and it depends on the type of approach. But if you see like this one-to-one in-depth interview or one-to-one interview, that is it is one of the common method of data collection. Whether you choose a grounded theory or you go for phenomenology or you do a narrative research or a qualitative descriptive or case study, whatever the design is, this one-to-one interview or the in-depth interview, generally, this is a part of all the type of qualitative research method. Means this is one of the data collection method which you have to know and you should know, because that's the most common rather way of data collection. So we just want to give the analogy of this in-depth conduction of this in-depth interview process and the analogy of driving a car over the highway. So if you wish to go to a place for picnic or for your vacation and you are planning to go by driving by road, so how you plan for that, similar thing you can remember while you are conducting an interview. So we'll see how to correlate between these two. So conducting an interview is like driving a car on a highway, and you have to reach to a destination. So your destination in this case is you should have a good interview at the end of this whole exercise. So we'll see the analogy at the end. So you have your interview guide, and we'll share that whatever you guys have submitted yesterday, we have compiled that. So using that, since it was done in a like very short period of time, generally you spend much time on developing an interview guide because you have to do the literature search. And yesterday we have seen how you make a literature map, how you identify the factors which are affecting your central phenomena. Then you make a central question, and then you make many sub questions which will act as a probe. And then you make the prompt also. We have also seen the difference between the probe and prompt. And we have also yesterday realized what is the difference between a closed-ended question and an open-ended question. And generally, you will see that whenever the answer of any question is like yes and no, or in very few words, then definitely you will not have a good transcript. And since the data in case of a qualitative research are the words, you don't have any figure. So those words, if there is a scarcity of words, if there is a dearth of words and statement, then it's not a good way of getting the data, and you will not be able to analyze it. So conducting the first thing, and that's a very important part, is please get out of this mind of data collection. Generally what happens whenever you go after training, you go to the field, probably if you yourself, the PI is taking the interview, then also you are going and you say also most of the time you say to the people that I'm going for data collection. The moment you say this data collection, you are making a very lively thing as a very inanimate feeling comes out of that if you say that I'm going for data collection. So that's why just keep in your mind that you are going to have a conversation with the people, because Of course, that is the data. In scientific term, we call it as a data. But generally, you want to know more about the person, you want to know more about the phenomena. And since your axiology is, since yesterday we discussed about the axiology, what is ethical and what we believe to be right, that's your central phenomena, and that's why you want to explore that. So you have to come out of this mindset of data correction. Again, there's one more mindset which is constantly playing in our mind, that we think that we are doctors, or we are not, like there are people from many specialities, we are very scholar people, and we are going to interview someone who are illiterate, and maybe they don't know much, or they know, or whatever they know, I don't know how much it will be accurate. So those images are running in your brain. So whenever you go, you are very judgmental, and I'm not saying that I am not, all of us are. And it is playing in an unconscious way, and not in our conscious mind, but unconsciously, with our everyday exposure to people, we are in a tune that we know everything, and we just have to confirm. But you are not going to confirm anything, so you have to behave like a lay person. Lay means lay, you don't know anything. Don't assume that whatever you know, the person is saying the same thing, because we rest assured, generally, if we hear the answer from anyone which matches to our own image, we rest assured that, okay, yes, he's saying the right way. But that should not be done. We will show you many interviews where the interviewer should have explored and dig a little down. But what happened, that he thought or she thought that, yes, this is the answer, and I think I should not go beyond this. So even if there are very small, like if we'll see, if there are stupid questions, you might think that I am acting like a stupid, but there's no problem in acting like a stupid. You have to act, because you know what the meaning you attach to something and what the participant attach. We have seen yesterday, there are multiple perspectives and there are multiple reality. So don't try to impose your reality, because otherwise you are the self-sufficient one, and you could have done the research only by your own vision and your own images. But you have gone for the data collection in the field, and you want to explore people's perspective. So don't put your perspective. And yesterday we discussed about the bracketing. Please practice it. It doesn't come in a day. If you wish to be in qualitative research, you have to practice this bracketing, where you keep your mind and your images aside and then listen to the participant. The second very important thing is, although the interview guide is a very rough guide, it is not a very tight guide. That means you there are flexibility, and you can, of course, gain insight from the interview and ask new questions. But you should memorize this interview guide. Memorize means, like, the main questions, and like 3, 4, 5 questions. Questions means generally they are the broad questions. You can have a copy of the interview guide with yourself, but it's better that you repeat those guide before going to the field so many times, that when you are talking, you should not be seeing that paper. Because we have seen the students, many of our students, generally the PG students, who generally go with the interview guide, and they just see the question and then they ask. Then they see the question and then they ask. And they will also go in a sequence. So that's not the way. And interview taking is an art. So it is not learned in a day. Even if you are a very good academician, you may be a very good teacher, you may be a very good researcher, but it is not necessary that you will take a good interview. So you have to memorize your interview guide. And with our experience, we can share our experience that initially, yes, when we started taking the interview, we started with qualitative research in 2017 probably. And that time, it was difficult. So we also used to see the paper and ask. But after like 3-4 interview, that guide, now there's a kind of remembrance, then you will remember everything. So what you can do, you can practice first 3 interview on any patient, where you don't include that interview, because what happens initially when you start taking interview, the transcript which you see later, most of the time you will be speaking and the participant sentences will be very less, because we are in a habit of speaking, so we will speak too much. So that's the problem. But if you are like doing it regularly, then definitely it can be learned and you will improve upon it. So you have to memorize your interview guide. The third thing, like I was discussing, we have to test this interview guide and we have to practice this, because there will be generally interviews conducted in the regional language. Like even if I convert the interview guide to Hindi, there are many dialects of Hindi also. And in Bihar also, you will see there are a lot of languages, like there's a Maghi, there is a Bhojpuri. So you should, if possible, through help of social worker, you should try finding out few words, and that in the pilot testing, you can do that pilot testing of that interview guide with few of the participants from the field who know about the language. So you can do that. This practicing of the interview guide initially you can do on your friends, but again as a pilot testing, and you can go to the field and you can select the same participants as the eligibility criteria of your study. If the interview doesn't go well, then you can do that, you don't include that interview in your analysis, but with that you will get a sense of practice, and you will also realize your mistake, where are you making mistakes, how you could have improved. So the participants ask, if you have gone to the field for the data collection, or here also in the institute, if you are doing something on medical education, and the participant, they asked for the interview guide after giving consent, what will you do? Will you give the interview guide or you will not give? Can you show me the chat? Okay. Dr. Ajay is saying no, and Dr. Rini and Irfan is saying no. So there are mix. Priyanka is saying, or we can say, I'll give after the interview is over. No and yes. Okay. So yes, if someone is saying yes, what is the reason of? I mean, what do you think? What will be the problem if you give it to them? What can be the problem for those people who are saying no? Because something must have gone to your mind once. Then I'll ask from yes people also. Yes, anyone? Dr. Ajay?
Hello,
Yes.
madam. This interview guide is for a interviewer to follow the same that scenario or whatever thing. If you give the participants, they will know in advance, and there may be bias. The answers may cannot come naturally, or so like that. I
Okay, so
think.
you are thinking that way. Okay. What about other people are because many people are writing social desirability bias, and will see probes and prompts response bias if they knew the answers. Okay. And the people who are saying yes, what are your take on this?
Maintain transparency, ma'am, after the interview so that there is no ambiguity left as to what was asked and the any alteration of the data what has come from their end.
Okay. So, yes, if you see the way, if somebody asks for the interview guide, you have to give it to them, because there's nothing like in this case, even if, see, social desirability bias will come if something like it depends on the question, but like if you're doing something on quality of life, or let's say if you're doing any qualitative aspect, so that person is going to say from his mind only, and the questions and the answers are so intricate and so difficult means by just one question, because if you see the question, it's not very clear cut. You will be asking like, what is your perception, what are the coping strategy. They are not going to see anything then and there, because of course they will not take the question like student and then they'll go and see the answers and then they are coming to you. If they ask for the questions, you can give it to them. They can just see, and they can make their mind, also make up their mind what to answer. There's no harm in it. And if you go classically, it's a good way to give if they ask for it. Even if you are interviewing people like who are in admin, like we did the study with the RSV vaccine, and we had to interview the district. Rajat was also a part. Rajat is here. So Rajat said, like he went and Rajat, can you share your experience with DIO?
Yes, ma'am. Actually, when we went for the RSV vaccine study for the interview, initially they were not very comfortable to answer. Then, after getting them into the confidence, then they asked for a copy of the study tool what we had. Then he went for almost like 10 minutes. They read the questionnaire and then they were a little bit comfortable to give their responses. So initially, even we were little bit worried whether we should give or not. And then after consultation with Pragya ma'am and Samshad sir, we came to a conclusion that we can give the study tool to them. So this is what happened, the PIO for the study.
Okay. Thank you, Rajat. So, actually, generally it depends on the context, but whatever is the context, if you are asking something from someone, you cannot deny. Because there is no something, we don't have any hidden perspective, we don't have any hidden agenda. We are a researcher, it's very clear. And even if, and assumption, remember yesterday we talked about the assumption, and we are going by the assumption that even if the person is saying, out of social desirability bias, that is the perception of society, you cannot change it. Suppose if he will cook the answer, but are you going to change that? We all do, isn't it? We are never truthful in context, but that is the perception of a human being. So why not to accept that rather than to be, you know not taking and not giving it. So yes, even in case, because we took the interview of state immunization officer and civil surgeon also, and they also asked, in fact they asked before, 2 day before, over the mail, because many times they think that if I'm recording, because you have to take the permission of recording also, so they have to make up their mind, like they should not say something which is not acceptable or against the government or probably against the health system. So it's their right, and we cannot deny them, even if they ask for it. Either it is a people who are in admin, or even if it is a participant. Generally participant, they don't ask. Why? Because they are in Bihar especially. People who are very literate and are holding a position, generally they who have got authority, generally they ask for it. And we have seen with our experience that it increases the trust, and it increases the confidence in the, because I am not a media person. Remember, I'm not a journalist who is going there to have some news, this thing, and I will gain something out of it, and I'm making. So we are just a researcher, an academician, which we are trying to explore something. And even if they answer out of social desirability bias, but that psyche is there in their mind, you cannot remove them. And that can happen even if you are asking a question. The problem will be like they might not answer your question. If many times, if they don't think, they will try to skip the question, or they will say few lines. So yes, it is a good idea, although in our experience, generally people who are at a higher position or higher level in the society, they ask for questions. But if someone asks, you should give it. You should have a copy of your questionnaire, and if you see your questions, there's nothing in it. Yeah, any questionnaire you see, there's nothing which they can answer out of social desirability bias, or they will frame the answer. It's just you are trying to capture their mind, what is happening in their mind. And for that, if they ask for it, there's no harm in it. So yes, sir, do you agree, all of you? If so, Dr. Ravi, you were agreeing before also. I'm asking for people who said no initially and then now. So you knew the correct thing. So nothing is incorrect actually. I'm not saying that incorrect, because again, for us also it's multiple perspective. So there are perspective of researcher. You all are researcher. So there is no right or wrong. You guys are not wrong in saying that you don't want to give. If you think that you don't want to give, then you just see. It should not hamper your interview taking process, because saying no is a very powerful word in the context. The moment you say no to someone, that initial bonding, that is going to break, even if you are a researcher. So that no hurts the other person some or the other way. And if you see in qualitative research, you want to respect the person's autonomy, and that we have seen also yesterday in the ethics. You don't want to hurt someone, and this is not something which I think probably. And if you go, definitely, this part we could not check in the reference if someone has says it or not, but in our experience what we have seen, it always pays you off in a good way if you share everything and don't hide anything from the participant. So coming to the location. So again, location should be like we have discussed yesterday. It should be a very neutral place. Neutral means, like, if you are interviewing someone in the village, and if you choose a place of Mukhia's house, it is not a good, it is not a neutral place, because there will be power differences. If the person wants to say something about the village, then he cannot say in front of the people. So that should be a neutral place. You can choose a neutral place in your locality. That may be a PHC, primary health center, or that may be a community room where usual meetings are held up, or a school can be there. If there are people from different religious background, you should try avoiding choosing a religious place like mandir or masjid or any other religious place. If there are people from multiple religion, you are planning to call them. But again, if it is everyone belong to the same religion, then you can choose a mandir also. Like we chose in one case, while we were doing the alcohol data collection for the alcohol, after that perception of people regarding the ban. So we had to do the interview in one of the mandir also. But again, since that was everyone belonging to the same religion, so there was no issue in coming to that particular place. Now coming to the recording, so generally you should have two devices. One you can that's for backup. So whenever you conduct interview, one can be automatic recorder, and the other can be your own phone. But whenever you you are recording on your phone, check for the memory, because many times what will happen, initial 20 minutes interview will be there, the later part will not be there because there was not enough memory. Charge it properly. You can have this thing, power bank also, if you are planning to conduct 3-4 interviews. And again, put the phone in aeroplane mode if you are recording. If you are recording on your phone, otherwise in between interruptions there will be that quality will not be very good. So one more question for you. So you should start recording just before taking consent for interview. So do you agree? Yes, no, or can't say?
Yes.
So yes, why? Because the initial questions generally you are asking the question to build the rapport. So if you think, again, it is up to you. It is not a rule. Generally, what we have experienced, that initial 10 minutes the participants talk. But that talk is not 10 minutes. I'm sorry, 10 minutes is too long. Like initial 2 to 3 minutes. Generally, you ask the questions like how they have come, the conveyance which they took, why they are, anything which has caused them to reach late. Because many times you will be waiting and participants whom you have invited, they will not come. So reasons for if there are some inconvenience or Thanksgiving and all those things, initially you will, there are conversations related to this rapport building. So if you record it, then again, you will have to listen that much in the recording. So what generally we do, we start recording just before taking consent. After the initial, we tell them regarding the purpose of our visit, we tell them regarding we give them the participant information sheet, we talk to them, we introduce ourselves to them, define the purpose of our visit. So all those things generally we don't record. Why? Because an unnecessary, that much memory will also be consumed from your devices. And again, when you are making the transcript, you'll have to listen that much, and then you have to start making transcript from the question which is needed. So Priyanka is asking, but for recording also we need to take consent. Yes, definitely. Before that, you cannot, in your consent form, you are getting their signature on the consent form. And I think all of you know the format of a consent form. If not, if needed, we may share you the format of the consent form. And there in the consent form, it's written that, you give the consent for the audio recording. So for that, whenever you are explaining, because consent also you have to read to them that they can withdraw at any point of time. And if they don't want to participate, nothing will be denied to them. All the services will be given to them. We will not deny from any services. And again, you have to say that this whole, whatever we will ask, it will be recorded. But again, you have to say thing also, if they wish not to say something or to pause, then you can pause also. Because this is our experience that many times the participants say, like, don't include this much part. So then in that time, you can pause the button, and then again, you can start taking the interview after they are done with that part which they don't want to include it in in their transcript. So yes, we need to take the consent. You need to ask from them, and again, you need to keep this line in your consent form that I give my consent for recording my interview on the audio.
Ma'am, regarding the interview guide,
Yes.
the interview may not know that we are using a topic guide or interview guide. In that case, is it mandatory that we share it with them?
Mandatory, if you can recall the question, if the interviewee said that they need, we
Okay.
are not sharing from our end. Are you getting my
Okay.
point?
Yes.
If they ask for, suppose if they ask for it, many times, people come to our home for selling something. We ask,
Yes.
like, show me your ID card. Then they have to show.
Yes.
Similarly, if they
Okay.
ask for, like, I need interview guide,
Okay.
then you have to give. You cannot say that I will not give. But
Okay. Even in consent form, we have to tell them that we are using an interview guide for this purpose.
No, in consent form, we don't say that we are using an interview guide. We are
Okay.
saying whatever we will be asking,
Okay.
that will be audio recorded.
Okay, ma'am. Okay.
Okay. So again, we know about the prompts and probes. So your sub questions will act like probes, and you should always do follow up questions of probing. Probing is again the question. There are many questions which will arise from their answers. We'll see few of the example, and then that's why you have to be very patient when you are taking the interview. There should be, we'll talk about this, that there should be at least two to three people in in-depth interview also. One person will manage the place. Manage in the sense means they should see that though nobody should enter, nobody should interrupt, and the place should be quiet. And the two people will be doing the interview part. One will be taking the notes, other person will be asking the questions, and the person who is taking the notes, he will also make sure, or he or she, that she should write the words or the things which she wants to clarify, because participants might say like a few things which you should explore further. What does he mean by that? Like if somebody says that there is a problem, I got delayed, there was a delay when I was standing outside, and that's why doctor did not give me the time, then you have to ask like, what does he mean by delay, or how much delay? So those questions should be there as a probe, because delay is also very, very relative. Relative means in here also, if you see in the OPD, everyone wants to be, showing on the priority basis. We are here. People call us that please ask someone to see to do it, first on the first come first, not on the first come first basis, but out of the turn. They want their services out of the turn. So that delay is again a very relative thing, and you don't know about the definition of delay of the participant. So consent so after this consent taking, then and consent we have talked regarding that you have to take the consent of the recording also. So now consider yourself as a interviewer. So if this is the question, what next question would you like to ask from the respondent? So like if this is the question, how has the patient dementia impacted the relationship dynamics in the family? And if the person says like, my mom requires 24-hour care, I'm often stressed about this and it is putting a strain on my marriage. So yes, what will be the new question? Chat.
Please describe how is it affecting your marriage? Or we can even enhance how is it impacting? Can you please elaborate strain on your marriage? What do you
Yes.
mean by strain?
Yeah, very right. Very right. Because and again, I think Priyanka has written, how do you deal with the stress? So yes, it depends. There are two sort of stem which can arise out of it. You can explore the stress means you can first ask about what. So like when she says like I am, or she or he, that I am often stressed, you can also express like explore often stressed means how much or what type of a stress. So first explore what. So what stressed? What are all forms of stress? And then you can include the question like you said, how do you deal with the stress? And again, like it is putting a strain on my marriage. This is a very important thing, because again and again you have to remember, again please remember your central question or your central phenomena, because you are not going to explore something which is not related to your central question. Otherwise interview will be very long, and you will not gain much from the interview. So please remember, on every top of every interview guide, please write your interview research question. So research questions you should keep remembering your research question. And that's why if my research question is not to explore too much of stress, of course I will ask about the stress. But if I just want to know the quality of life of a person, then I'll go more for this define what kind of strain on my marriage. So it depends. Again, both Priyanka and Dr. Ravi are right. You can go to any direction, and you can also ask like what type of care. If she said that my mom requires 24-hour care, you can also elaborate on this, like what all care do you give in the 24-hour basis, and then you can go further. So any question is possible. From the answer, it depends on your research question, and try probing related to your research question. So again, this is a new one question, like why do you prefer an auto injector as compared to the intravenous injection? If this is my question, and if the interviewee has answered that auto injector is more convenient because I can administer it at home and it takes less time. So what will be the next question if you can ask from this making question from?
What are the difficulties you face using the intravenous injection?
Yes.
What inconvenience does it cause? And it also says less time. So what do you mean by less time?
Yes, perfect. So you have said everything, Dr. Ravi. Thank you. So this is the way you should probe. Whatever they say, don't like, because it might be a case that you are also using auto injector and you are not using IV. It can be a case. So in that case, if you don't ask their opinion and you just assume whatever you know, oh yes, and then you start saying, because many times our PG students and the resident, they take the interview, and we see the verbatim and the transcript. So they rest assured. So they will just imagine ki yes, they will not ask anything related to this, and then they start with the other question, next question. So initially, when you start taking interview, they go question by question. Like they ask one question and participant said something, that's the stop. Then they will ask another question and participant said something, and then they'll stop. Then they'll ask another question, participant said something, then they will stop. So it's like, they think it's very cute in a way, because if you see the transcript, it's very innocent and honest attempt. But the problem is that digging deeper, it wasn't possible. It was not there. So that how will you analyze? You will have very less in the transcript. So that's why in the beginning, because there are different people here, you might feel that you are talking more and the person is talking less. So first thing, please have patience and give time to think to the participant. Don't be in hurry. If you ask something, wait, because sometimes what happens, that you want to break the silence first. If they are not saying anything, and that we have experienced initially, I was always in hurry. That if somebody is not saying anything, and if there is a silence, you start feeling very uncomfortable, like why this silence is there. So then you start speaking if participant is not speaking. So that happens in a gathering also. If everyone is silent, there's a kind of, sometimes there's a kind of discomfort. So there will be one person who will break this silence. But in case of an interview, this silence is important many times, because if you just hold yourself, then the participant will say something, or you can encourage them to say something. So that is there. Again, this question is there, like what signs do caregiver observe that tell them their loved one is having asthma symptoms? If the answer is like, I know my daughter is having a hard time with her asthma when she is wheezing. So what could be the next question?
What do you mean by having a hard time?
Yes.
And
Yeah.
how do you identify symptoms of asthma?
Yes. Rightly said. So this is how you can further put a probe, and you can explore their perception on a particular question which you have asked. Again, the next is like, you may ask the same questions in a different way. Like Dr. Ravi has just said with this, the auto injector, that if they use a IV injection, what inconvenience it would have caused. The other way around. So that's the same thing which he has given an example, that the same question you can ask in a different way, so that you will get the answer. If he's not answering this way, you can put it in another way, and that is your art. That cannot be taught, because that's so much. You have to be in present moment. If you remain in the present moment at that time fully, definitely you will be asking things which you want to know. And again, like I said, you should ask silly questions, because if you are asking this question, hard time, you might think that, why I'm asking, like, what do you mean by hard time? Because we know what is a hard time. Hard time means I'm not good at ease, or I'm having some difficulty. But again, I said that you have to keep your brain aside. Keep your brain aside, whatever it is thinking, and think that you are a layman. You don't know anything. You don't know Hindi. You don't know the meaning, and explore what are they saying. So that's why you should ask silly question. And that way you will see, we have experienced that whatever you are thinking, they will say exactly opposite to that. So again, here you can see the participant said that the doctor came very late. And then next question, if you have to ask the same, some silly questions again. Doctor came very late. What silly question can you can ask?
What do you mean by late?
Yes. Yes. Or means like, you can ask a different way, like you have just said. This question can be asked in many ways, like how late it was, or I mean, you have to take the perception of this late. Because late many times here only in our this thing happened. There was a duty in the examination, like there was a PG exam, and all the residents, they were supposed to come by 8 in the morning. And I think there was one resident who arrived at 8:03 or 8:04. So there was a faculty who like scolded him a lot, a lot, a lot. He was into tears, and then he was saying, his question was like, is 4 minutes late is a late? So again, that happens with us also. Uh, us means like it depends what is the event. Yes, for some like people in army, or maybe there are many. If the someone is running 100 meter, even 1 second late is fraction of a second late is late. But you have to see in everyday life what is the meaning of late. So that meaning you should explore from the participant. And again, this was one question that doctor said that I usually remain engaged in the department meeting after lunch. So what question can you ask? So Dr. Ravi is writing, what engagement do you have and how long you were engaged? Okay. So this, agree, you have put 2 questions. Again, we will see that in the next example. So questions are okay. And Arun has also written, Dr. Arun, where you early and how long have you been waiting? Okay, yes, good one. So the idea behind asking silly questions is that you are not going to assume whatever the participant terminology or whatever is their perception or whatever is their thinking process. You are acting like a layperson, and in the whole process, what you are doing, you are keeping your brain aside, bracketing yourself. Bracketing means you are like keeping your emotions, you are keeping your images, everything aside, and you are asking as if you don't know anything. And again, next very important point is regarding note taking. So note taking is like whenever one person is taking the interview, I said that if there are a team of 3 people, it's a good way to have a coordination. So the second person generally takes the note. Note taking, generally we call it as a field notes, and we will also see this when we will see the session on analysis, that note taking generally it should be done simultaneously also. If you want to ask something, if you want to clarify something, you don't interrupt the person, because if the person is in flow, then you don't interrupt. You keep your question. If something has come to your mind, you keep a note of it, and then you ask once he's done. So that is note taking habit will be helpful. And again, if something is there after that interview gets over, you can write your own reflection. That is also very important. Reflection about that whole process of interview, and the reflection about the, this in the situation around that, regarding any disturbance which has arisen during the process of interview. Again, after the interview is over, you should say thanks. We all say that, and you should write notes and reflections, and you should if in the follow-up this thing, we'll see it in the ethical this thing also, which is also known as the member checking. So you should give project updates also, and many times we share a copy of, you should share a copy of transcript depending on the literacy status of the person. So we'll discuss this in the analysis also. So being a good interviewer means that first thing, you should have a good knowledge about topic of interest. And we all assume that since it is your axiology and you have done enough literature search, so you are the best, you are the best person to ask from that particular topic. And so that's why you are knowledgeable. The second thing is like you are structured because you have a semi-structured guide, which is a kind of a flexible guide. So you are structured, and then you are very clear because you should ask or frame the questions which are clear, which are easy, and which are very short. So please ask short questions, because they will not put their don't put cognitive load over them asking very lengthy questions. So ask very short questions. And you are gentle in handling, you are patient, so you are giving time to think to the participants, and you wait for some time, you don't interrupt in between, and you are very sensitive. And how can you show this sensitiveness also? So there is, again, you can paraphrase their words. So whenever they are saying something, you are listening it attentively. And paraphrasing is also a way of member checking. Member checking means you are confirming what they have said. So if they say something and you repeat the same thing, and then they say, yes, yes, I have said the same thing, that increases the repo also, because then they will think that you are listening, first thing. The second thing is, if they say yes again, if you have repeated, that means they are sure, you are sure that he wants to convey the same meaning. And third is like, it helps you in forming questions out of their response. So that's why patient listening and active listening, rather, that's a very important trait when you are conducting an interview. And again, you are open means, if there are some issues which the participant have asked, and if there are something which participants don't want to say, then you should respect the autonomy of the person, and you should remain flexible in asking questions. And again, since you are steering, because you are leading the interview, it's you who is leading the interview. And in between also, if the person is digressing, many times it happens that if you are asking something, and if they are narrating some episode of the wedding or something related to the accident, so they'll keep on saying the same thing. So you have to bring them back to your main research question intelligently, so that they should not feel that you are not listening to them. So listen to them for a few minutes, and again bring them back to the main topic. This is very important. You don't have to, neither you have to agree nor disagree. Why this is so? Yes, can someone say, even if you are not saying something, if you even show it from your gesture, they'll catch it. Yes, how it can affect? So Dr. Rini is writing, be neutral, non-judgmental. Yes, because say if they are saying something and inadvertently or unknowingly, if you show your consent, yes, yes, then they will say only those things which you were just saying, social desirability bias, or to please you something. And if like you make your faces, if you are not convinced with whatever they are, oh, is it like so? Then they will come to know that you are not liking this type of answer. And then they will be very cautious in answering anything. Yes, they might stop. And that happened. Initially, when we started taking interview, even me and there was one more person with me, we two were taking the interview. So initially, I was like, I was taking the interview of people who are suffering from HIV, and he was telling me regarding how the wife got contracted. Being female, I was a kind of like very, you can say, not very happy knowing that his wife was no innocent, and how she can get, and like people were blaming the wife for the disease, and husband kept on hiding the disease status and told everyone that because of his wife he got the disease, but it was the other way around. So when I was listening this, I was kind of like, why he's saying like this, and why he's behaving like this. So even if you don't say, that thing will come to your in your non-verbal. So that person, then he stopped, he did not say anything when he saw me like in little bit of anger. So then I realized that you should be very actually saying these things and actually practicing. There is a gap. Like I'm saying this to you, and probably I don't know if I am taking something, and if it is not suiting to my ideologies, how will I behave exactly? So you should try. I'm not saying that we will be 100% perfect, but you should try being non-judgmental. And it's an again art and science both. So you learn by practice. So the moment you start practicing something, you learn it. So now I think I'm better in terms of not showing what is happening inside me, and keeping my face and body language to a neutral tone to a larger extent. But again, I don't know, maybe many times. So I have told you this because I'm telling this, but don't think that in a day you will be non-judgmental, because we all have preconceived images and notions. There can be a scenario, but again, try not to uh, show it up. So then again, you should remember whatever whatever they say, because again you have to paraphrase and it improves your rapport building. So Dr. Arun is asking, should we be neutral or interactive? Can you put that chat up a little bit? Should we be neutral? So best is if you can maintain a neutral, not interested. Neutral. Neutral is the best way, because interested also, then he might say something to please you if he's seeing. And if you are neutral, that is the best position, because then the best chances are that you will get a clear response. And with neutrality, what we have experienced, that you are patient also, and you can hold your emotions also. So rather than interested, it's better to be neutral. Don't be interested also. Neither show very positive thing, because initially we are very excited. We want a good rapport. In the initial part, you can be interested. Interested in taking their family history, talking to them regarding their journey, talking to them regarding their, job or occupation. Those questions, you remain interested and you remain, you praise them. That can be there in the initial part. But when you come to the actual question related to your research question, then be very neutral. Is it okay, Dr. Arun? So this we should remember what we have said, and again we have seen this, like whatever we are listening, we should paraphrase it, and we should interpret it, and we should summarize in between. That is a way of member checking also, like you are having a agreeable nod from the participant that yes, they have said the same thing. And allow for a natural flow while interviewing. And again, but again, you have to bring the interviewee back or the respondent back to the track if they are digressing, but allow a natural flow of the interview. So if you see the driving analogy, if there is a low fuel in the car, then your car might stop in between. And that is the analogy with the low battery of the recorder. So check the battery status of the recorder before going to the field, and save the initial recordings to your drive. Don't keep it in the recorder, otherwise the memory will be exhausted. If there is a clear road, the speed of your interview, the speed of your car is very high and good. So if this clear road is like smooth interview, if there are no interruptions in between, if no person is coming in the room when you are taking the interview, then the interview will go very good. You don't, if you are running very high speed in a car, which we discussed, like when you are driving on the highway, then you cannot see the scenery which are going side by side. You cannot enjoy the nature, and you will always be in hurry to reach the destination. So we say that you should enjoy the journey also. Don't be in a hurry to reach the destination. Similar thing is with the interview process. Don't be in a hurry to complete the interview. Like, I have to complete this task in, like, there are many people who will say that I'll take 4 interview today. I'll go and I'll finish it off. But don't be in that mode, and go and enjoy it, basically. If you will enjoy it, definitely the interview will be very good. And at the end, both you and the interviewer will be happy. And narrative will also be very good. So if it is interview is conducted in a very hurry, then again, narratives will be very poor. And that's why but if you are very slow, then the quality will be compromised, and it will be too much of information, and there will be overload of information which is not needed. So you should keep an optimum speed of your interview, like the optimum speed of the car. So a good speed is a good narrative. In between, you can take the break. So break you are taking in the form of something which is not related to the research question. So if they are digressing a little bit, you allow them to digress. That's the break. And then you can bring them back to the main question. And if there can be some natural calls also. So again, these are same as the narratives, not related to research. And when you are driving, you may face the jam, the traffic congestion. Similar analogies, the participant also, like they may need to pick up the call, or some conversation with their relatives who is standing outside. So in that case, again, you please press the pause button of your recording. Otherwise, it will exhaust the memory of your recorder. So there are checklists for this processes of quality monitoring of interviews also. I'll just show you that checklist. So you can just see this. This is the we have to decide and fix mutually agreed date, venue and time. Then check the recorder battery status and memory. Keep a notebook. I think someone else can read this. Yes? Can someone read this?
Decide and fix mutually agreed date, venue, and time for interview after administrative approvals. Check the recorder battery status and memory. Keep a notebook and pen for note taking if face to face interview. Keep the hard copy of interview guide. Introduce yourself and state the purpose of the study. Verify the concern to participate and ask if the respondent has any questions to ask. Inform when you start recording. Provide adequate time to respond. Show interest and curiosity. In the end, ask the exit question. Debrief and summarize main points. Check that the audio is recorded properly. Store the consent form audio record transcript in a separate folder in a password protected computer system.
Okay, thank you, Dr. Priyanka. So this is just a rough checklist. You can keep, before you start the interview, you can just keep a check on it. So that will help you in maintaining the log. And again, in this case, there was one more question. Like if someone says, like if you have gone for taking the interview, and if that person says that no, I don't give my consent for this audio recording, will you take the interview or not? Suppose you are interviewing the civil surgeon, or any even if the patient, if they say that no, you cannot record whatever I am saying, will you take that person? So someone is saying no, and so again, is it okay if write down? Yes, you can ask like, see, just because someone is not giving you the consent for recording, you should not, know deny that person. I mean, you are not denying actually. You should take the interview of the person, and you should keep you can ask from them like, can you write it down? If they say yes, because there are people who are very apprehensive. Like if you talk about recording, they might say that please don't record. And these days again maybe, but again if you like convince them, you can give it a try. If they don't agree, in spite of that, then again you take the interview, but you note down the their responses. But for that again you should have someone who is very fast in noting down the responses. One thing. The second thing is, immediately after finishing the interview, you should write your own reflection. The third thing, in the methodology, you can mention that these many interviews were audio recorded, but two interviews were like it was only handwritten, because no after note taking process was done, because the consent was not given by the participant. So that you can do. So I'll just show you this interview, this IDI, and you have to keep noting down your observation. Means you can keep on giving it to the chat box and writing to the chat box. We'll be seeing the responses. Let me share the audio, sound, and the video optimization. So share this.
Hi, my name is Allison Jones. I understand that you've been to several chart trainings, and I am the qualitative interviewer, and so I'm interviewing people and asking them for feedback about the training and how it went. For them and all of that. So is it okay if I talk with you about that?
Yes, of course.
Great. So what is your name?
Shay Bloomer.
Okay. Profession?
I'm a nurse.
Great. And how long have you been a nurse?
I've been a nurse for 12 years.
Okay. Did you enjoy the training?
Yes, I did.
Would you say that you enjoyed it a little bit, a medium amount, or a lot?
I enjoyed it a lot.
Great. Okay. And did you learn something by the training?
Yes, I did.
Excellent. Okay. And would you recommend it to a friend?
Yes, I would.
Great. Okay. So can you give me an example of something you learned? For example, some people have learned that they may think that they're not discriminating and that they're very open and respectful of everybody, but then when they actually get down to it and they go through the training and they understand that there are things that they actually do have some sort of biases in them, and they may not have known it, but then the training helps them discover it and then just helps them be very self-reflective and that sort of thing. Do you think that maybe that's something that you learned in the training?
Certainly, I think some of that was covered in the training. We also learned about taking sexual history and effectively taking a sexual history, which is a sensitive topic, and it's not something that I was trained in my professional education. We also learned about patient confidentiality and the importance of maintaining patient confidentiality in order to protect our patients, and both of those, I think, were very relevant for me.
I'm sorry, can you say that last part again? I got distracted. I'm so sorry.
Oh, it's okay. I believe I was talking about how we talked about the importance of patient confidentiality and maintaining confidentiality of patient records in order to protect our patients.
You've been talking a lot about what you learned, and now I'd like to ask you a little bit about what you've done differently. I mean, it's one thing to say we learned something, but then it can be quite another thing to actually try to do something differently. So can you tell me anything that you may have done differently because of the training?
So what I'm doing differently since the training?
There must be something that you did differently. I mean, think about it, you know, anything, because you mentioned these different things that you learned about. So can you think about, you know, maybe keeping your voice softer or spending a longer time with patients or being more empathetic than you were before? Anything like that? Do you think any of those may be things that you did differently?
Yes, I'm sure they must think that I'm more empathetic than I was before.
Great. Okay. So now let's talk about the training methodology. Do you think it was effective?
Yes, it was.
Great. And how was it effective?
Well, it was a very interesting training. I was happy to be there.
Great. But it helps you learn and do your work differently?
Well, perhaps.
Now I'm a little bit confused because it seems that you're contradicting yourself. I think earlier you said that it helped you learn and you were doing something differently, but now you seem to be changing your mind. And so now I'm just very confused. Can you clarify for me whether you did something differently because you learned from the training or you didn't?
Well, what I mean to say is that I think that I've always done my job well, and I like my job, and I think that I've always been respectful of my patients, but I think that there are certainly some things that I'm doing a bit better than I did before the training.
Great. Okay. Great. Thank you. So that's all really good. Thanks. So would you like us to provide you with more training on this or any other topic?
Well, yes, actually, there are a number of different trainings that we could profit from at my facility and that I personally would like to attend. I am very interested in a health administration course that's offered in Washington, D.C. At Howard University. I'm also very interested in having some more in-depth training on diabetes, which of course is a large concern for us. I am also interested in taking some further training in care of pregnant women who are HIV positive. There are, I think, a number of trainings that would be of interest.
Can you just say that again? I didn't get that last part.
Pregnant women who are HIV positive?
Okay. Okay. So, what are some of the other problems at your facilities?
Well, one of the concerns that we've been going round and round with the administration about is some of the water issues in the examination rooms. The running water isn't working in some exam rooms, which limits the number of rooms in which we can do certain procedures because the water's not running or there's not. So that's one issue. The water's not working in a number of the exam rooms. I think there's also some communication issues, some systems issues between the pharmacy folks and the people who are in the wards. And I think that it would be useful for the hospital if we were able to have some communication issues resolved between the pharmacy and the ward.
Okay, great. I think it's about time for us to wrap up. Is there anything else you'd like to say?
No, I don't think so. Did I answer all your questions sufficiently?
Yes, just great. Thank you so much.
Thank you.
Bye-bye.
Bye-bye.
So yes, you guys were absolutely right in writing the comments. And I think, yes, she was very fast. She was not sensitive. She was not a patient listener. And many times, she interrupted, like, can you repeat the last part? I could not listen. So those things, yes, your observations are correct. And now this was an interview which was like all the negative findings. Now you see another interview, the next one.
Hello, my name is Allison Jones. I understand that you've taken a series of chart training workshops. I'm doing qualitative evaluations about the training so we can learn more about how participants think about their training and what they've learned. So I'd like to ask you about your experience with the chart trainings. Is that okay?
Yes.
Okay, great. Can you tell me your name, please?
My name is Shay Bloomer.
Shay Bloomer, okay. Can I call you Shay?
Yes.
Okay, thank you. And Shay, what do you do for a living? What's your profession?
I'm a nurse.
You're a nurse. How long have you been nursing?
I've been a nurse for 12 years.
Oh, interesting. So first I'd like to start out and just kind of get your immediate reaction to the training, your memories of how it felt to be in the training. What was your favorite part of the training and your least favorite part of the training?
Well, I would say that my favorite part of the training was that the facilitators really took time to have discussions with us, and it was a very open kind of discussion that we had about a number of the topics that we were discussing, and I felt like I wasn't just being told things. It wasn't a one-way sort of experience. We were very much learning from one another, and it was exciting to be in a group with my peers and to be able to discuss the issues that we confront every day and learn different ways of approaching them.
Mm-hmm. I know the training was a while ago, but I'm wondering if in these conversations that you were having with the facilitators and with some of your colleagues, can you remember any particular topic that was especially interesting for you?
Well, one of the topics that we talked about was taking sexual histories. And as nurses who are working in HIV care and in testing, it's often important for us to take a sexual history, but it can be very uncomfortable, for example, depending on who the patient is. We have patients who come in who seem too young for us to need to take a sexual history, patients who frankly seem too old for that to still be relevant. And it was interesting to talk about how we all sort of approach it in a different way and how a number of us, frankly, were fairly uncomfortable with the topic, but having this kind of discussion about it really helped me to feel more empowered to talk to all of my clients about their sexual history.
So I heard you say that you're now taking these sexual histories differently. And I'm wondering if, because you're taking them differently, if different kinds of information actually comes out from your consultation with the patient.
Yeah, I think certainly, because the truth is that I was so uncomfortable doing them before that I often sort of skipped over it or found ways to just ask yes/no questions and get through it. And so now that I'm more comfortable taking the history, I'm actually doing it with all of my patients.
Can you think of any ways that that might affect the actual care the patients receive?
Definitely, because before I wasn't thinking about a number of these patients in terms of needing the kinds of services like HIV testing, and now I realize that the elder generation is sexually active and I'm taking their sexual history and some of them do need to be tested.
Can you tell me anything else that you remember learning from the training?
Well, one of the things that we discussed a lot at the training was patient confidentiality, and I feel like I was aware that confidentiality was important. I was not aware of the many ways that we can accidentally violate patient confidentiality. And it's caused me not only to look at my practice personally, but to also be thinking about the way things sort of happen in our clinic, because there are a number of things happening in our clinic that I actually think are making it harder for us to maintain patient confidentiality.
That's interesting. Can you tell me more about that?
Well, for example, we have a very small waiting area that's directly in front of where all the patient records come out, and we have a limited number of consultation rooms. So a number of times during the day, conversations need to happen among providers, and there aren't very many places for that to take place. And often what ends up happening is that at the desk where people are waiting to sort of sign in and things like that, we are having discussions about patients. And we always sort of I think of that desk as being a barrier, but in fact it doesn't block sound. And so I think that that might be an issue, that we need to have a safe space for providers to be able to have discussions about patients.
So it sounds like this is something that you've noticed at your workplace, that this area may not be, it may have been treated as a confidential space when in fact it's not. Have you noticed anything that's changing in addition to your own recognition of this?
Well, I've started whispering and trying to keep my voice very low. And I've talked to other colleagues about it to try to find another space.
And how's that going for you?
Well, we have limited resources, and so we're working on trying to identify a space, but because we really need the consultation rooms to see patients, it's been challenging.
So can you tell me about any of the activities that were done in the training that have really stuck with you?
Well, one of the activities that we did was an activity where we talked about the different words for the body parts that are in our vocabulary, because so many of our patients don't use the sort of scientific terms that we use. And so I think it helped to sort of desensitize us to that language and get us comfortable with all the language that patients might come in using. And so it was both sort of entertaining and also a little awkward at the same time.
I'm hearing you laugh as you say it, so it...
Yeah, it was fun to have sort of this group of professionals in there sort of throwing around this vocabulary. Yeah.
Okay.
So we have stopped this in between. Why? Because you all knew now how to take the interview and what all to avoid, what not to do. And you all know that how you could appreciate the difference between the first interview and the second interview. Yes, a few people have written that she was looking at the interview guide. If there are many questions, I said that you should have a copy of your interview guide and you can see in between. In between means like when she's saying and she has done answering his part, then her part, then you can definitely see the interview guide and then you can ask the question. There's no problem in that. in between, like looking at the interview guide. But again, most of the questions you should not, whenever you ask, don't look down. You should, like many people have written that eye contact was there, and sensitivity was there, and she was a patient listener. She was waiting for the respondent to complete and then posing her question, and the questions were very clearly articulated. So those, and again, questions were framed from the previous answers. So all these things you have seen, that was correctly pointed out by all of you. Uh, that's all about the process of taking the interview. Now, I'll just show the interview guide. So before I show you the interview guide, there is one more concept, which is the key informant interview. So how this key informant interview is different from the in-depth interview? We have discussed this yesterday also, but key informant are people, or the persons who are experts in a particular field, or who hold a key position in the community, like the district immunization officer or state immunization officer, which Rajat was talking. They are the key informant people if you are doing something on immunization, or if you're doing something on school children, then school teachers, or if you're doing something related to health system in the village, then probably the PHC, then medical officer in charge, or the block health manager, or mukhia. They are the key informant. So basically, many times the key informant may not be the member of the community, means representative of the community, but they will be the expert. So it's always good to have key informant interview, or key informant as one of your stakeholder, and all other interview the process is the same as you have seen with the in-depth interview. So now there's a breakout room activity, and using the interview guide, you have to conduct the interview for 5 minutes at least, and 5 minutes each person. So I think we'll see how many people are there and how many breakout room to be opened. And we are giving the sharing rights to record the interview to all of you. So all of you, please record that interview
Only
from
laptop
your.
पे होगा.
Yes, but again, I think what Dr. Shamshad has seen, that many people have joined through mobile phone. So if you are joining through mobile phone, then you cannot. It's difficult for you to record. You cannot record actually.
Yes. Yes. Like
I'm
yes.
asking the question next. So now, what you have to do? Can you please just type yes in the chat box? Those of you who have joined from a desktop or laptop.
आनंद उसका पेयर करेगा उसके.
So Dr. Anand will make a breakout room keeping one person. So Ajay Kumar, Rini, 4, 5. So there are, I think, people. Dr. Ravi is yes.
आनंद नोट कर देगा.
So Anand, please, Dr. Anand, can you hear me?
Yes, ma'am, I am there. Ma'am.
Okay, so you can just see the people who has said yes with their Praveena, then Nitin, Rini, Ajay, Dr. Ravi, Priya, Dr. Pinaki, Paramita. So there are people. So what you can do, you keep these people with laptop in separate rooms, and then the other pair them with someone who is not having the laptop. Then both the recording can be done on the laptop, and then they can share the recording with the other person.
Okay, ma'am.
Have you understood what we are planning to do? Since the interview cannot be recorded on the mobile, what you do, the people who have said yes, open these many breakout rooms, and then keep the other set of people who are having mobile in with each one of them, and keep 2 people in one room. I think there are how many? 15, not more than, because there are people from our
14.
end also. So 14 breakout room, probably.
Maximum.
Open 14 breakout room.
IDI is open.
And yes, wait for 2 to 3 minutes. Let me show the interview guide.
और अगर रिकॉर्डिंग नहीं हो पाए तो नोट्स ले लेंगे.
Okay.
Deductive framework.
So this is the interview guide. And you can see initial, there was an introduction, and then there are demographic information. You can skip this, and in 5 minutes, you cannot ask everything. So you can choose one deductive framework. Like first is like understanding communication barriers. So you can ask regarding patient-related barrier or health worker-related barrier or administrative barrier or impact on this. So any theme you can pick up. Any theme means any topic, because you cannot ask in 5 minutes, you cannot ask everything. So whatever you feel like asking one part, you can ask. So 5 minutes for each person. That means one person will be taking the interview, will be acting as a interviewer, and the other person will be acting as an interviewee. After 5 or 7 minutes, the role will be rehearsed. Now the person who has acted like an interviewer will be acting like an interviewee, and the next person will be acting like an interviewer. Okay. And then recording, we have given the recording rights to everyone. If because of some reason there's a problem in recording, then at least you can take the notes. Keep taking the notes, write your reflections. And you, in the breakout room, you will find the recording button on the upper right corner. So before starting, we have shared it, Dr. Nitin,
What?
on WhatsApp. Again, we are sharing it. And in that, press that recording button on.
Moderator कौन है?
Here, there is no need. I mean, Anand, don't put moderator, because then interview will be affected. So let only participants do. Moderator will be there. If they need any help, you can come to the main room and you can ask for help. We can send someone to your room. So are instructions clear to everyone? And if there is any ambiguity or anything which you need any further explanation, do ask now. Otherwise, Dr. Anand, please open the breakout room.